Hi, my name is Dr. Joseph Kaye, and I own a practice called Body Logic MD of Boston. We're located in Woburn, Massachusetts, right off of Highway 128, exit 35, and that's the Woburn-Wilmington exit. The practice is what I would describe as functional and integrative medicine. I'm classically trained as both an internist and an emergency physician. I've completed residencies and taken board exams in both specialties. But on top of that training, I have added training in a holistic type of medicine. What that is focused on is, number one, the safe and effective use of bioidentical hormones in both men and women. Number two is diet and weight loss, both as a treatment for disease and to prevent disease in the future. Number three is what I would call anti-aging and functional medicine. And that means we take everything that's available to us in the 21st century, nutrition-wise, drug-wise, fitness, stress management, hormones, and we target it in a way to slow or even in some cases reverse some of the symptoms of accelerated aging. And I think this is really an exciting type of practice. The use of bioidentical hormones to treat the symptoms of either menopause in women or andropause in men or hormonally related problems in a person of almost any age is something that's been done since the 1950s using different types of treatment. The key is to do this safely and with some knowledge of how these hormones work in the human body and how to test the levels. And also, it should be done by somebody who understands the interactions of these hormones with the other processes in the body, with nutrition, with fitness. And I try to incorporate all of those modalities in my practice. I think that's something that makes my practice a little bit different than others, in that I am aware of all these other interactions, and I do thoroughly assess diet and fitness, and I do the necessary testing to measure levels so that these medicines, and they are medicines, are delivered safely, and then the patient gets the results they're expecting. Pellets are hormone implants, and they're about the size of a rice grain. The usual hormones that are delivered by an implant are testosterone or estradiol, the main estrogen. And this is a virtually painless procedure, and the beauty of it is I call it set it and forget it. You get an implant and then you don't need another one for 4 to 6 months in some cases. I can get very, very steady and predictable and reliable blood levels using pellets, something that's very hard to do with injections or creams or pills or other modalities of hormone replacement. Weight loss, no pun intended, is a large part of my practice. Almost everybody wants to lose a few extra pounds, but some of my patients really need to lose 50, 60, even 100 pounds. And we have implemented a fantastic solution in our office. I have a dedicated staff member who serves as a weight loss coach, who works with my clients and sees them on a weekly basis at no charge, and coaches them on their diet. And we use a system called Ideal Protein. It's safe, it's effective, the food tastes great, it's not expensive. I personally have taken 25 pounds off of fat, not muscle, in 1 month, and that's not an unusual result. Our typical patient is losing 5 to 6 pounds of fat per week if a woman, and up to 7 pounds of fat a week if a man. Now remember, this is a medically monitored program. It's not something that you can do at home. This system is only available through a physician's office. We use certain supplements that replace missing minerals, and we monitor blood pressure and other vital signs and the patient's medical condition during the program. But we've had no bad outcomes, we've had no complications, and I have to tell you, our weight loss clinic day is one of the happiest days of the week. It's full of smiling patients from morning to night. TA65 is a medicine that was developed by Geron Pharmaceuticals and is licensed for commercial distribution today by TA Sciences. I am licensed to prescribe this medication. I'm the only physician in New England who's able to prescribe this medication. And the clinical studies on this product are really quite amazing. The way it works is by activating an enzyme called telomerase. Now, telomerase is an enzyme in every cell whose job is to maintain the integrity of the chromosome tips called telomeres. Now, what is a telomere? A telomere is the biological clock. Every time your cell divides, this telomere shortens by a little bit. When it reaches a certain length, no more cell division, the cell ages, the organism dies, and you've reached your maximum lifespan. Well, the amazing thing is that this compound has been shown in the lab, in animals, and now in people to extend those tips of those telomeres. We monitor the telomere length with some sophisticated testing, and we monitor it during the treatment to see that you're responding. So this is all done, quite scientifically and carefully, this is a very exciting development in anti-aging medicine. There are many other compounds that are equally as exciting that we have access to, and I provide to my patients as needed. If you're interested in becoming a patient, call our office directly at 781-933-4200. Or you can learn more about my practice and my clinic in particular by going to my clinic website, www.optimalwellnessmd.com.